So a FODMAP diet is a natural way to treat irritable bowel syndrome, or IBS. So irritable bowel syndrome is when patients have abdominal pain and some type of stooling problem, either diarrhea or constipation or an urgency to go to the bathroom. So FODMAPs are carbohydrates that are in foods that can cause gas, bloating, diarrhea, or constipation in sensitive individuals. These carbohydrates are rapidly fermented by the bacteria that live in the large bowel or large intestine. As the bacteria consumes the carbohydrates, they produce large amounts of gas. Also, FODMAP's carbohydrates are capable of chemically attracting extra water into the gut. The colon stretches to accommodate the extra gas and water. This can cause a painful sensation for individuals with irritable bowel syndrome. In order to go on a FODMAP diet, you really need help with a nutritionist. A nutritionist can help tell you what's on the diet and also give you tips so that your diet is nutritionally complete and you're not starving yourself, that you can find foods that you like to eat.
The FODMAP diet is a diet that's low in fermentable carbohydrates. FODMAP stands for fermentable oligo, di, monosaccharides, and polyols. And this is referring to certain starches and sugars and carbohydrates that are fermented in the body when certain foods are eaten. The FODMAP diet includes foods that are low in fermentable carbohydrates. For example, lactose-free milk and dairy products like lactose-free yogurt. Certain fruits and vegetables are allowed. Certain gluten-free grains are allowed. Meats and proteins, and fats. The typical patient will stay on the FODMAP elimination diet for 2 to 3 weeks. This is the first phase of the diet. After phase 1, then we move on to the challenge phase of the diet. Sometimes I will have somebody stay on the diet an extra week or 2, depending on how their symptoms are progressing. I highly recommend meeting with a dietitian when you're starting the FODMAPs diet. A dietitian is trained to provide you with the education you need, the materials you need, provide you with support, and really help you plan the diet for your child so that you're not having any nutritional inadequacies, which is always a concern when any child is on a restricted diet.
I think the biggest challenge was definitely like going out with friends or like staying at a friend's house and not being able to like eat anything really. My favorite food was probably just like I would like cook chicken and put it on like a corn tortilla, and like I ate that all the time. It was like my favorite thing. It helped me a lot, and like it is hard, like, but it really did help me in the end.
Were you able to find foods to eat on the FODMAP diet?
Yes, there was lots of gluten-free options and like alternatives to what I would normally eat. My favorite foods were gluten-free pretzels and peanut butter, and like peanut butter and jellies and stuff like that.
Is there anything you would like to say to other people considering the FODMAP diet?
I would say go for it and try it because it really helped out a lot, and it really isn't as bad as it seems at the beginning.